Hi, I am Professor GeorgeRazay. I'm pleased that I had two presentations at the Australian and New Zealand Society of Geriatric Medicine annual meeting in Sydney 2025. My first presentation was on the book Dementia and New Hope, which gives information and a guide for general public on the prevention, diagnosis and treatment of dementia, Alzheimer's disease and normal pressure hydrocephalus. There is extensive chapters on risk factor for Alzheimer's disease, especially the role of obesity, abdominal obesity, the metabolic syndrome, diet, especially polyunsaturated fatty acid, blood pressure, and also the role of exercise, in which regular exercise can improve cognitive function even in patients with Alzheimer's. There is also extensive information about the normal pressure hydrocephalus. It's a condition that results from build-up fluid inside the cavities of the brain, leading to a problem with memory, cognitive dysfunction, balance and gait disorders, and also urinary incontinence. It's diagnosed through brain imaging like brain CT scan or MRI of the brain, and it's important because it can be treated by inserting a shunt in the cavities of the brain, leading to improvement not only with balance and walking, but also in memory and cognition and urinary incontinence. There is also 4 chapters of case studies to show the improvement in patients before and after shunt surgery, which prevented people from going to nursing homes. The last chapter looks at what can we do to prevent dementia, which include looking at the role of gardening, music, and also dancing. My second presentation was to look at the incidence of normal pressure hydrocephalus. Unfortunately, people think it's rare cause of dementia, accounting for only 1 to 2% of people with dementia. In our population of people attending the memory disorders, we found nearly 15% of people have normal pressure hydrocephalus. When we looked at divided people between those who have balance problem or not, we found more than half have balance problem. So people of memory problem with balance problem, then nearly a third of them have normal pressure hydrocephalus. And when we looked at those without balance problem, then nearly more than a third have Alzheimer's disease. We also looked at the incidence of normal pressure hydrocephalus among people with dementia, and we found that nearly 43% of people have normal pressure hydrocephalus. However, the people with dementia who did not have balance problem, then more than 3/4 have Alzheimer's disease. And I think this the study showed that it's important to seek early assessment diagnosis and treatment for dementia, because some form of dementia can be treated with significant improvement in their cognition, balance and incontinence, which can prevent them from going to nursing home. Thank you.